Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on hepatitis E virus. So let us discuss what is hepatitis E virus. As you know that hepatitis E is a liver disease caused by hepatitis E virus HEV. Although rare in developed countries, hepatitis E is widespread in the developing world. In the vast majority of people, HEV infection results in a self-limited acute illness. However, acute infection can become chronic in rare cases, primarily in people who have received solid organ transplants. How common is hepatitis E in the United States? Hepatitis E is not commonly acquired in the United States. Most cases of symptomatic hepatitis E in the United States occur among people who have traveled to a developing country where hepatitis E is endemic. Sporadic, non travel related cases of hepatitis E have been identified in the United States. No clear exposure was identified for these domestically acquired cases. Sporadic cases of hepatitis E in developed countries, including the United States, are primarily caused by hepatitis E virus genotype 3 and largely affect older men, those more than 40 years of age. Where is hepatitis E most common? Hepatitis E is most common in developing countries with inadequate water supply and poor environmental sanitation. Hepatitis E epidemics involving large numbers of people have been reported in Asia, the Middle East, Africa, and Central America. People living in crowded camps or temporary housing, including refugees and people who are internationally displaced, are at particularly high risk. What are the different genotypes of hepatitis E and where they can be found? Hepatitis E virus is unique in that it has a different clinical and epidemiological profile depending on where the infection is acquired. This can be attributed largely to the viral genotypes circulating in different parts of the world. Four genotypes of HEV causes illnesses in humans, each displaying different epidemiologic and clinical characteristics in developing and developed countries. Cases of hepatitis E typically present in one of the two ways, either as large outbreaks and sporadic cases in areas where HEV is endemic, genotype 1 in Asia and Africa, genotype 2 in Mexico and West Africa, and genotype 4 in Taiwan and China, or as in isolated cases in developed countries like the United States, genotype 3. Recently, a new genotype, genotype 7, was identified in a liver transplant recipient from UAE with a chronic hepatitis E virus infection who frequently consumed camel meat and milk. Now discuss what are the characteristics and the genotypes. Suppose genotype 1, the geographic location is in Africa and Asia, and the transmission route is waterborne, fecal, oral, person to person, and groups at risk for infection are the young adults. Zoonotic transmission is not reported, and chronic infection is not reported, and the occurrence of outbreak is very common. And now we will discuss about the genotype 2. The characteristics are the geographic location is in Mexico and West Africa, and transmission route is waterborne and fecal oral, and groups at high risk for infection are young adults. Zoonotic transmission is not reported, chronic infection is not reported, occurrence of outbreaks are at a smaller scale outbreaks. Then we would come to the genotype 3. The characteristic geographic location is in developed countries like USA also, and transmission route is foodborne. Groups at high risk for infections are older adults more than 40 years and males, immunocompromised persons. And zoonotic transmission, yes, probably occurred, and chronic infection also exists, yes, and the occurrence of outbreak is uncommon. Then we would come to the genotype 4, which has the characteristic geographic location in China, Taiwan, and Japan, and the transmission route is foodborne, and grouped at risk for infection are young adults. Zoonotic transmission is possible, yes, and chronic infection is not been reported. Occurrence of outbreak is uncommon. Now the transmission and exposure. How is the hepatitis E virus spread? HEV is usually spread by fecal oral route. In developing countries where HEV genotypes 1 and 2 predominate, the most common source of HEV infection is contaminated drinking water. In developed countries, sporadic cases of HEV genotype 3 have occurred following consumption of uncooked, undercooked pork or deer meat. Consumption of shellfish was a risk factor in a recently described outbreak that occurred among cruise ship passengers. HEV genotype 4, detected in China, Taiwan, and Japan, has also been associated with foodborne transmissions. Can animals spread the hepatitis E virus to humans? Yeah, hepatitis E can infect certain mammals, and consumption of undercooked meat or organs from infected animals can lead to foodborne transmission to humans. HEV RNA genotypes 3 and 4 has been extracted from pork, boar, and deer meat. What are the symptoms of hepatitis E? When they occur, the signs and symptoms of hepatitis E are similar to those of what occurs the other types of acute viral hepatitis and liver injury. They include the fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, jaundice, dark urine, clay-colored stools, and joint pains. The ratio of symptomatic to asymptomatic infection ranges from 1.2% 1.2 raised to 1 raised to 1.13. So, who is most likely to have symptomatic HIV infections? Many people with hepatitis E do not have symptoms of acute infection. In developing countries, symptomatic hepatitis E commonly occurs among older adolescents and young adults, suppose people with the age 15 to 44 years of age. Pregnant women are more likely to experience severe illness, including fulminant hepatitis and death in 20% of cases. How soon after exposure will symptoms appear? When symptoms appear, they usually develop 15 to 16 days, mean 40 days after exposure. How long does an HIV infected person remains infectious? The specific period of infectiousness for hepatitis E virus has not been determined, but the virus excretion stool has been demonstrated from 1 week prior to the onset to 30 days after the onset of jaundice. Chronically infected persons shed virus as long as they remain infected. How serious is hepatitis E? Most people with hepatitis E recover completely. During hepatitis E outbreaks, the overall case fatality rate is about 1%. However, for pregnant women, hepatitis E can be serious illness with mortality ranging 10 to 30% among pregnant women in their third trimester. Hepatitis E can also pose serious health threats to people with pre-existing chronic liver disease and organ transplant recipients on immunosuppressive therapy, resulting in decompensated liver disease and death. Can hepatitis B become chronic? To date, there is no report of progression of acute hepatitis E to chronic hepatitis E in developing countries, where HEV genotypes 1 and 2 are the predominant causes of illness. However, increasing numbers of hepatitis E genotype 3 infections acquired in developed countries are progressing to cause chronic hepatitis and chronic liver disease. These chronic cases occur mainly among solid organ transplant recipients receiving immunosuppressive treatment. What is the diagnosis and treatment? Who should be tested for hepatitis E? Hepatitis E virus infection should be considered in any person with symptoms of viral hepatitis who test negative for serologic markers of hepatitis A, hepatitis B, and hepatitis C, other hepatotropic viruses, and all other causes of acute liver injury. Any symptomatic person who has traveled either to or from an hepatitis E endemic area or outbreaks afflicted region should also be evaluated for hepatitis E virus infection. A detailed history regarding travel, sources of drinking water, uncooked food, and contact with jaundiced persons should be obtained from these persons to aid in diagnosis, because domestically acquired cases of hepatitis E are occurring in the United States. HEV infection also should be considered in any person with unexplained symptoms of liver injury. regardless of travel history. How is hepatitis E diagnosed? Because cases of hepatitis E are not clinically distinguishable from other types of acute viral hepatitis, diagnosis can be confirmed only by testing for the presence of antibody against HEV or HEV RNA. Both serologic and nucleic acid tests are commercially available, but they have not been approved by the US Food and Drug Administration (FDA) for use in the United States. These tests are used for research purposes, but some commercial laboratories use commercially available assays from other countries. Where can I learn more about hepatitis E serology? CDC offers an online training that covers the serology of the hepatitis E and other types of viral hepatitis, so you can go on and have an online training. How is hepatitis E treated? Hepatitis E usually resolves on its own without treatment. There is no specific antiviral therapy for acute viral hepatitis E, and physicians should offer supportive therapy. Patients are typically advised to rest, get adequate nutrition and fluids, avoid alcohol, and check with the physician before taking any medication that can cause damage to the liver, especially acetaminophen. Hospitalization is sometimes required in severe cases and should be considered for pregnant women. For few cases, reports, and case series have indicated that modification of immunosuppressive medication or use of antiviral drugs may result in spontaneous viral clearance in immunocompromised patients with chronic hepatitis E. How is hepatitis E being prevented? Prevention of hepatitis E relies primarily on good sanitation and the availability of clean drinking water. Travelers to developing countries can reduce the risk for infection by not drinking unpurified water. Boiling and chlorination of water will inactivate hepatitis E virus. Avoiding raw pork and venison can reduce the risk of HEV genotype 3 transmission. Immune globulin is not effective in preventing hepatitis E. Is there a vaccine for hepatitis E? No FDA approved vaccine for hepatitis E is currently available in the United States. However, in 2012, a recombinant vaccine was approved for use in China. So, this was all about hepatitis E viral infection. I hope so that this video will be more informative for you and you have got more information about hepatitis E viral infection. I will end with the quotes of Alexander the Great. One of them is, I am indebted to my father for living, but to my teacher for living well. And second one is, there is nothing impossible to him who will try. The third one is, I am not afraid of an army of lions led by a sheep. I am afraid of an army of sheep led by a lion. And the fourth one is, when we give someone our time, we actually give a portion of our life that we will never take back. Sixth one is, my treasure lies in my friends. And in the last, for my part, I think that the man of his spirit, there is no other aim and end of his labors except the labors themselves. So thank you also for listening the quotes of Alexander the Great. If you liked my video, then kindly subscribe my channel and have a wonderful nice day. Thank you for listening this video. Thank you very much.